improve or develop mental health services among students. I will take that again. Ideas on how to improve and or develop mental health services among students. That is the basis of the interactive session. So before we get to the interactive session, please, you can jot down points, ideas when it is time for the interactive session, because everyone, don't let me say must, everyone, at least 80% of you should be able to contribute. So before we get to the interactive session, you are to write out ideas on how to improve mental health among students. Thank you. Did we all get that? Thank you. All right, moving on to the next item on the agenda. Can we all rise for the Abuad anthem? Can we all rise for the Abuad anthem? Let's all rise for the Abuad anthem. Yes, media, we are ready. Media, can you give us the anthem, please? I think we should start without the sound. Yes, thank you. 1, 2, 3, go. Abuad we come, oh, Abuad we come, Abuad we come. With aesthetic structures, a beacon university, delivery unequaled, designed for high quality education to mold character and infuse knowledge how to lead others. Proud of Abuad, the launching pad to excellence with determination and faith in Abuad philosophy of industry, service and character. Our future for greatness and excellence is assured. And excellence is assured. And excellence is assured. Thank you. Can you just give yourself a round of applause? All right. Now moving on, the introduction of dignitaries. All right, in absentia, I would like us to appreciate the founder of this great university, Are Afe Babalola. Yes, with a round of applause, please. You can do better. Yes, his wife, Yeye Aremodupe Babalola, in absentia. Thank you. Now, to the Chief Medical Director, Dr. Kola Wole Ogundupe, in absentia. Can you just give him a round of applause? You can do better. You can do better. Thank you. Now, to the Deputy Chief Medical Director, Dr. Akinola Akimade. Thank you. The Director, Nursing Services, Dr. Mrs. Taye Olukolade. The Chief Administrative Officer, Mrs. Olanike Olusegun. Thank you. Mrs. Kanmodi Kehinde, the Matron in charge of Mental Health Department, AMSH. Mrs. Aleshinloye Y.A., the Senior Nursing Officer. Dr. Michael Ungu, Medical Officer, AMSH. Please, you can do better with your applause. Thank you. Now, the Dean of Students Affairs, Dr. Yinka Ajiboye. The man that would be giving us the lecture for today, Dr. Joshua Falade. Please, you can do better. You want to learn from him. Thank you. All right. Yes, moving on. All right, we're trying to beat time. Now, the welcome address would be given by the Dean of Student Affairs, Dr. Yinka Ajiboye. Please, can you just applaud him? You can do better. So before he gets here, I forgot to actually tell you all to appreciate yourself for being present here at this program. Can you just give yourself a round of applause? Is that how best you can clap for yourself? Thank you.
Good morning, everyone. All protocols are duly observed. However, I think I must still very much acknowledge the founder and chancellor of this greater university, our own father in this community, Are Afe Emmanuel Babalola, CONSAN, and his amiable wife for the great works they are doing for us all in this greater community. And I want to also salute the local organizing committee for this anniversary of the Abuad Multisystem Hospital for the great work they have been doing so far all through this week. And most importantly, I also want to acknowledge all of our dignitaries who are here seated today. And of course, all of us who are seated today, we are all very, very, very important. Great Abuad students, great Abuad students, great Abuad students. You are not demonstrating it that you are indeed great Abuad students. You are duly recognized. Why are we here today? Of course, it is important that we know the reason why we are here. I'm not the lead speaker. Our speaker today will be able to tell us. Of course, I'm not even a medical person, but he'll be able to tell us indeed the reason why we are here. Of course, as you do know, the theme for this year's anniversary, of course, is centered on mental health. And of course, when we talk about mental health, you know, the mind of many will go to the fact that, oh, those within the, what do we call the department now? In the psychiatric care unit. Of course, that's what the natural mind of most of us will go to, but that is not the case. Of course, all of us, we do have, you know, most people around, you know, we have challenges, one challenge or the other, of course, that affects our status, the well-being of our mind, of course, and the brain, all together. So it is important that we actually take proactive measures for us to be well educated about the wellness of our mind, the wellness of our brain. And that's the reason why we are here today. Many of us, we suffer some things that, you know, sometimes you don't even know who can I share this with. You know, at the end of the day, that leads to depression, that leads to many things, and that's, you know, what leads, you know, to students, you know, engaging in different advices and so on. And the reason why we are here today, it is not just all about even the lectures. I'm very sure that our lead speaker today, is going to, of course, educate us very briefly. But most importantly, the thing we need to know today is that this is supposed to be an interactive session. Let us be able to understand what mental health means. Let us be able to know, by the time we are beginning to have one challenge or the other, who can we run to? Who can actually give us information about the wellness of our mind and brain altogether? So on this note, on behalf of the Vice Chancellor of this great university, the Chief Executive Officer of this great university, Professor Elizabeth Asmaranda Olanride, who is unavoidably absent because of the Senate meeting that is currently ongoing. However, she will join us in the course of this program. I want to welcome every one of us to this program, and I wish us all a very fruitful deliberation altogether. Thank you very much.
Please let us applaud the Dean of Students Affairs once again, Dr. Yinka Ajiboye. Tell someone beside you, guard your mental health. Do you have someone beside you? You are not talking. Guard your mental health. Yes, as time goes by, it's going to get more unveiled. All right, so I want to introduce to us Miss Adedotun Eson. She is a mental health advocate and founder of the Mental Health with DT Foundation. Yes, can you applaud her, please? Miss Adedotun Eson, thank you so much, ma. And also, the school counselor, Mrs. Folorunsho Yetunde. All right, thank you. Please, like I said before I commenced the program, that there's going to be an interactive session, and we are going to be discussing ideas on how to develop mental health services among students, among yourselves. All right, so please, even as the program is going on, just take your writing pad and jot down points. Thank you. All right. Moving on, I would like to bring up stage Dr. Joshua Falade to give us a short lecture on why we are here. Can you just please appreciate him? Thank you.
Good morning, everyone. Good morning. Good morning. I am glad to be here this morning. I want to especially thank our father, the founder of this great institution, in person of Ariafe Babalola, who has a lot of passion for mental health. and health in general. Then special thanks to the wife, Yeyare Modupe Babalola. I cannot forget the Vice Chancellor for our passion for mental health, and all the university administrators. My Chief Medical Director, the Deputy Chief Medical Director, the Head of Nursing Services, Dr. Olukolade. Thanks for all you've been doing for mental health, and especially the mental health team that we have been working together in person of Dr. Mike, Dr. Luasami, Mrs. Komodi. They've all been fantastic. And everyone that have been working closely with the mental health. This morning, briefly, I want to discuss something that will nosedive into the interactive section. And I want us to listen carefully so that you can help us, because the goal of this is to help you and to help ourselves. So you need to give us tips, you need to give us things that we need to do to develop our mental health. So the title of what I will speak to is what I call the student mental health. The student mental health. Next slide. So I will use the following outline to define some words, talk about student mental health, how common is mental illness, a common presentation of mental illness, how to protect our mental health, then to conclude. Let me start with defining health. There are like 4 domains that we need to talk about when you say you are healthy. It is a continuum, because today you can say you are healthy and tomorrow you find out that you are not healthy. Before you can say you are healthy, you must go through the following domains. Number 1, WHO define health as a state of well-being. The slide, please. When somebody, you are healthy physically, mentally, socially, not merely in the absence of disease or infirmity. Before you can say you are healthy, mental health is an integral part of health. So if you are not sound mentally, if you are not sound in your cognition, the way you talk, the way you reason, it means that you are not healthy. Even if you have the power to move all mountains and you cannot reason well, you cannot talk well, you cannot associate well, it's obvious that you are not mentally sound. Next slide. Mental health. Mental health has to do with, is a state of well-being. Let's look at that definition well. No, go back. Mental health is a state of well-being when an individual realizes his own ability. You have to mark those words, because the first presenter, the Dean of Student Affairs, talks about our picture about mental health. If we say picture about mental health, I'm sure what comes to our mind is to see somebody that is started, ragged, and so on and so forth, walking the street naked, eating from the gutter, and so on and so forth. But that is wrong. That is not mental health. Mental health is your own ability, 1, to realize your own ability. That is number 1. You need to take that. You realize your own ability, because your own ability is different from mine, fundamentally. That is 1. 2, to be able to cope with the normal stress of life. That's second definition. 1 is to realize your own ability. I'm sure there are many students of science here. There is what we call Hooke's law. If you have not forgotten, it's quite long that I've done physics, but I don't think they have changed it. Hooke's law states that provided the elastic limit is not exceeded, force is directly proportional to what? Student of science, to what? Hello? Student of science, don't thinking, behavior, or you combine one and the other. There is an expert at the aspect of mental health that we are discussing now. That's the student mental health. The student mental health is an integral part of mental health. It started in 1950. This aspect of mental health has to do with discussing the causes, the prevention, and the treatment of mental illnesses among students. Students as special group of cohorts, because apart from the social, economic and political instability, they are faced with the stress of reading. I'm also a student. They are faced with the stress of reading. They are faced with the stress of passing exams. They are faced with the stress of writing thesis and so on and so forth. Apart from the normal stress that they go through. So because of this, they are unique. We put them together in mental health to discuss their own health as student mental health. Let's move on. Next slide, please. Yes. So how common is mental illness among students or generally? Mental disorders are prevalent. In the general population, it is close to 50%. 12-month prevalence is about 15 to 25%. That tells you that mental illness are common. They are common. As we are seated, significant proportion are issues that they are going through. Next slide. Yes. So in Nigeria, about 20 to 30%. So it's like 1 in 5, or 1 in 4 of the proportion of people that are gathered together had mental illness. Let's move on. So these are studies. These are studies that we can go through. In this study, yes, in the first study, this study is done in Ekiti State. Next slide. You found out that about, if you look at it critically, about 25% of this cohort, they are students, had psychological illness, while 14.3% of this cohort had comorbid anxiety and depression. These are studies that you can find in the literature conducted by our department. Yes, let's look at another one. In this study, we found out that 21.0 of this is done among College of Health Sciences in Southwest Nigeria. So you found that 21.0 of this cohort had psychological illness. And the last one, yes, the last one is looking at the association of premenstrual syndrome and depression among female undergraduates in Nigeria University. This is done here. You find that significant proportion of this of the cohort, about over 80% of the of young ladies that had premenstrual syndrome had depression. Let's move on. So what are the risk factors for mental illness? When I say risk factors, it means that the things that can predispose someone to have mental illness, especially among students. Number one is family history of mental illness. For those that their parents, whether single parents or both, had psychological illness, the risk of them having mental illness is high. Then parental separation and early parental deprivation. If you are from a home that the father, the mother are not together, or separation from the parents, the risk of having psychological illness is high. Dysfunctional family system, history of abuse, both physically, sexually, or emotionally. Those that have been abused in the past, they have high risk of having psychological illness, especially rape. 2 days ago, I was in a forum among university students who were discussing rape. And you find out that in my clinic, you find out that significant proportion of young ladies that come down with depression, if you probe very well, they have had rape in the past. And most of this rape, they are incest. So this is another thing going on, especially among female students. Rape is not female. It's not a female agenda alone. Male are also being raped. It's just that it's more among the female students. Recent traumatic events like death, failure, all these can dive into psychological illness. Then recent change of role or status. You find out that the issue of the risk of mental illness, they are not things that are bad alone. Even marriage, success in exam, promotion, and all those things. All these can be a risk factor for psychological illness. Let me give you an example. I manage a young guy for bipolar affective disorder. What happened, what precipitated the illness is that he bought a new car. Don't let me mention the name of the car. After buying this car, he found out that he could not sleep. He woke up at the middle of the night and he will go to the motor park Look at the car. Is the car still there around? It goes there around 10 p.m. Is the car there? Go back to sleep. 12, again. Is the car still there? Go back to sleep. 1, 2, and so on and so forth. From there, he had, the sleep was not adequate. So from there, he had psychological illness. You find out that the risk factor, the precipitating factor for that illness is the fact that he bought a new car. So it's not a function of losses alone. Even some things you gain, if you are not careful very well, if you don't manage it very well, it could nosedive into psychological illness. Another one is added responsibilities. Added responsibility. If you are looking for a position and you have added responsibility, responsibility comes with is stress. If you cannot manage that very well, there's a risk of having psychological illness. Then relationship problems, you see that more among adolescents. Relationship problems, boyfriend issues, girlfriend issues, and so on and so forth. All these, if they are not well managed, they could be risk factors for psychological illness. Then career choice and progression. You see that more among students. Career choice. I want to be this. My father wants me to be this. Yeah, in our practice here, we've managed series of issues like this. There are risk factors. They want to be engineer. The father wants them to be this. Don't let me mention any profession. You understand? It's common among some profession. If you are this, you want your son and your daughter to be this, so that they can inherit this. And unfortunately, the person is not saying it from that angle. If things like that happen, there will be a conflict. There will be a conflict. Because your father wants you to take after him, but you want to take after A, B, C, D. If that is not well managed, the choice of choosing your career can indeed be a risk factor for psychological illness. Yes, next slide, please. Yes, common mental illnesses. Yes, next slide. 1, common presentation of mental illnesses. Presentation, excessive sadness. We all feel sad when bad things happen or things don't go in our way. As a matter of fact, feeling sad is normal because it's normal emotional reaction to something. So you can feel sad if things don't go your way. But it becomes a problem if it is excessive. That's why I use excessive sadness. That's one. Then excessive happiness. Yes, you can be happy if you get good money now, you pass your exam, and so on and so forth. Yes, you can be happy. But it becomes an issue if that happiness is excessive. Because if it's excessive, it may be pointing towards another thing entirely. I know somebody will say that everything in mental health is diagnosis. If you laugh too much, they give you diagnosis. If you are not laughing, they give you diagnosis. If you are looking, they give you diagnosis. It's not like that. Excess of everything combining with other symptomatology can form diagnosis. Poor sleep. If you are not sleeping well, it's a presentation. It's common among people with psychological illness. Then lack of concentration. You see that more among students because for you to pass exam, you must read, you must assimilate, and you must produce. That's the definition of memory. In memory, you must code information, you must read information, you must code the information in your brain, and you must decode it. That is memory. You must read, you must code, and you must decode. Some people have problem of coding information. Some people have problems with decoding information. They've read, but it gets to the time that they need to bring out the information. They don't get the information. So, memory problem, lack of concentration can be a symptom of psychological illness. Then mood swings. You are happy now. Sometimes you are sad. You're sad, you are happy. You can't follow up. Your mood is not consistent. If you don't have a consistent mood, then that may be a presentation of psychological illness. Then irritability and excessive anger. Well, sometimes we get angry, it's normal. But it becomes a problem when it is excessive. You get angry on little things. You get touchy on little things. If it's affecting your functioning, then we may have to look for other things and be sure that it is not more than what you think. Then abnormal behavior. This is you can pick this abnormal behavior when people are going like this. The person is going like the other way. The behavior is not within the context. It's not within the culture. It's not within the culture, the educational background of the person. So these are common presentations of psychological illness. Next slide. Yes, excessive fear. Fear. When the fear is excessive, it's also one of the presentations of psychological illness. Then abnormal belief. We call it delusion. Abnormal belief. Belief that it's not in keeping with your background. It's not in keeping with your educational status. It's not in keeping with the culture of the environment. That is what we call delusion. It's one of the symptomatology of mental illness. Then when you hear voices of people you don't see in clear consciousness, when you have, we call it hallucinations. You have voices or you see things that others cannot see in clear consciousness. Then you need to watch and to be sure that it is not from the realm of psychosis. Then talking to self, smiling to self, and abuse of psychoactive substances. All these are symptoms that you see among people with psychological illnesses. Suicidal ideation, suicidal thought. When you feel that you just want to take your life, you are not happy with yourself, and the next thing is you want to end it all. You just want things to go, you want to end it all. If that thought is recurring in your mind, or you have attempted it, you see that more among students mutilating themselves, cutting themselves. We see that in our clinic, and we admit to the extent of taking all sorts. In nowadays, if you hear sniper, is synonymous to suicide. If anybody is going around with sniper now, you want to ask yourself and ask the person, what are you doing with this? Because many people use that to commit suicide. Yeah, what are the common mental health disorders? The common one that we see around. Number one is depression. In depression, the mood is low, the person is not happy, find it difficult to concentrate, the memory is affected, there's suicidal ideation, the person is not eating well, he's losing weight, he just want to be on his own, stop attending lectures, and so on and so forth. When you have this and it's occurring, then you want to, it's good to see the patient to be sure that the patient is not having depression. Another one is anxiety. Anxiety is excessive fear and worry. Excessive fear. They are tensed, their blood pressure, heart rate is on the high side. They are irritable. They find it difficult to sleep. They are afraid of everything that comes their way. And sometimes they are afraid. They don't even know what they are afraid of. They are afraid. They know they are afraid, but they don't know what they are afraid of. We call it fear of unknown. They are afraid of the unknown. When this happens, it's an anxiety disorder. Yes, next slide. Yes, substance problem. Substance use disorder, this is common. Substance use disorder is another thing. And now, from the conventional substances, people move away from the conventional substances, which are cocaine, marijuana, amphetamine, cannabis, and so on and so forth. People now take different things now, Colorado, Datura, Stramonium, and so on and so forth. Things that may not be dictated by the regular diagnostic kit, substance use disorder. Yes, let's move on because of our time. Yeah, sleep problems, sleep disorders, parasomnias, find it difficult to sleep. 1.25% of those, the Abuad students that were admitted. Yes. Okay. We're managed for substance use disorder. So it means that number one on the list among students in Abuad is substance use disorder. And it's not Abuad phenomenon alone. Substance use disorder is everywhere. It's everywhere. Drug, adolescent take into drugs. Not an Abuad phenomenon. It's a global health. Number 2 is regular physical and mental examination or assessment. You need to assess yourself physically. As you do blood pressure, you do pulse rate, and so on and so forth. It's imperative for you to assess yourself mentally. Then adequate rest. Yes, I know students, you want to read, prepare slide, presentation, and so on and so forth. But you need to rest. You need to know your elastic limit. I started from there. You need to know your elastic limit, know when to strike, know when to rest, so that you can refire and do well. Then exercise. You need to exercise your muscle, exercise yourself. Then you need to set a goal, and your goal has to be smart. What is smart? Your goal has, next slide please. Your goals has to be specific. Your goal has to be measurable. It has to be accurate and realistic and time bound. You have to use this principle to set your goal so that you will not be in problem. Students, I want to read 3 pages in 24 hours. You understand? Time bound, specific, accurate, measurable. And in 3 hours, check it. Have I read it? Yes. Have I not read it? Why didn't I read it? So that's how to have a specific, a smart goal so that you will not run into mental health problems. Then you use adaptive coping strategies, because one of the definition of mental health is ability to cope with the stress of life. Life is stressful on its own. You are in 100 level in medicine. I'm a doctor. In 100 level, you were battling with physics, chemistry, biology, and so on and so forth. In 200 level, you'll be battling with anatomy, physiology, biochemistry. 200 level, 300 level. In 400 level, they take you to pharmacology and pathology. You are consolidating on the ones that you have. Like in 500, 600 level, you are now doing clinical medicine and so on and so forth. You finish that, you want to do residency, you finish that, you want to do masters, you want to do PhD, and so on. All these things are stressful. They are stressful. So you need to adapt, and you need to cope with those things. So you need adaptive coping strategy, because life itself is stressful. Number 1, you talk with mental health experts when you are psychologically down. You understand? If you feel that you are down, you are not happy, things are not going your way, you may need to ventilate, and you talk with someone. Positive reframing. Yes, be positive in your mind. Even when things are not going well, just be positive and move on. Acceptance. Don't run away. You face your troubles, face your worries. Look for a better strategy to cope other than running around. Religion is good, but you have to be careful. Religion can be a risk factor for psychological illness, as well as a protective factor for psychological illness. So use religion judiciously. Then humor. Make yourself happy. Your happiness is in your own hands. It's not in the hand of anybody. Yes, let's move on. Okay. Yes, seek help. If you are in any trouble, don't be confined. Seek help. Ask people for a solution. Then try as much as possible to solve the problem. Obtain information. Information is power. If you are passing through something, ask people, how can I get out of social therapy? These 3 things are important for early diagnosis and treatment. Next slide, please. Then rehabilitation. That is the tertiary care. Rehabilitation. That's the action of restoring someone to health or normal life through training and therapy after illness. It means that some damages have been done, and we need to bring the person back to the normal state. That is rehabilitation. Yes, in conclusion, we must know that, 1, there is no health without mental health. That's psychoscience. If you are not healthy mentally, it means you don't have sound health. I will advise you to see the university administrators, university counselors, members of the mental health team for advice, diagnosis, and treatment. That is important. Yes, let's move on. Next slide, please. These are my recommendations. 1, parenting style and the principles and its relationship with emotional intelligence should be understood by parents and caregiver. I know there are parents here. We must understand that parenting is indeed a risk factor for psychological illness. If the parenting is faulty, then the child or the children are at risk of psychological illness. Regular mental health screening alongside general health check. Well, if you check your body, please check your mind and your brain. Then mental health issues should be duly managed to prevent psychological illness. Mental health issues, promotion, admission, roles, and so on and so forth. Death, traveling, all these things are mental health issues. They should be duly managed. You should manage them well. Relationship should be duly managed because this can nosedive into mental illness. Next slide, please. Yes, if you feel or you have strange experience, kindly see a mental health expert. Yes, my parting word. Yes, these are clinic Tuesdays and Fridays, 8 a.m. to 4 p.m. Please, if you are feeling strange, you have anything disturbing your mind, please, you have great physicians, psychologists with us. Please see us in the clinic. Yes. So there are other mental health services in the university, drug-free club, counseling unit. Please see them. They operate 24 hours. Yes. Next slide, please. So how can we improve the Abuad mental health services? Because student mental health requires a collaborative effort. That's the next thing we'll do. Next slide, please. This line 090-1838. Please write it down. If you want to call us, that's the mental health department number. Please write it down. If you call that number, somebody will pick and somebody you can talk to someone. Yes. My parting word. Well, I will take my parting word from the book of 2 Timothy 1, verse 7, which reads thus. Say, for God has not given us a spirit of fear, but of one, power, 2, love, and 3, sound mind. And that is sound mental health. Thanks for listening.
If truly you learned one or two things, more than 3 things, please rise to your feet and give the speaker a round of applause. Rise to your feet. Rise to your feet. Though you are students, there's no one pregnant amongst you. Rise to your feet and clap for the speaker. Thank you. You can sit. Standing up now at least would have helped your mental health in a way. All right. Did we learn something from the speaker? Did we learn 1 or 2 things from the speaker? We are students. Please, can you be more vocal about it? Did you learn 1 or 2 things from everything the speaker has just presented? Yes, because I learned a lot. I know while some of you were pressing your phones, I want to believe you are taking down some points. Some of you are chatting. I wouldn't know, but I want to believe you are taking down points. This is a topic that we need as youths in this present time. How many of you believe that with me? How many of you? Yes, you have friends who have mental issues. And most times, if we don't check ourselves, you don't know you have mental issues yourself. I found myself in most of the things that the speaker listed out. And I know you found yourself in 1 or 2. There are so many things we do that affects our mental health. Thank you. Now, I want to ask a question. The speaker projected a word, SMART. He gave the acronym of the word SMART. Yes, who can tell me what S stands for? Yes, the lady at the front. I can't hear you. Specific. Thank you. M. From this row. M. It shows you are not listening. From this row, yes, M. What did you say? Thank you. Measurable. A. Accurate. All right, so those of you on this row, please don't say anything. I want those here. It seems they are not part of us. Yes, we are on R now. What the R mean in the acronym SMART? Yes, R. I didn't get that. No. No, you are not part of us. I knew it. I knew there was something about this row here. Yes, back to the row that listened. Yes. Thank you. Yes, and T. Time bound. Please give yourself a round of applause here. Thank you. Those of you here, I think we need to engage you more. So, all right. He also said something about the common mental health issues that you would notice in someone who has mental health issues. Yes, on this row, can you give me one? Those of you here on this row, to my left. Yes, I'm waiting. The reason why I'm doing this is because we are going into the interactive section and it has started. Yes, on this side, the common mental health things you see in someone who has mental health issues. Yes. No. No. The first one starts with D, with a D. Depression. Thank you. Thank you. No, he said those are the common presentations of mental health. Now this one is common mental health symptoms. Disorders. At least you remembered that. Disorders. Thank you. All right, so there we have depression, excessive fear, substance use. We have it in our present days now. Some of you have ordinary headache. You have open paracetamol. You chew it as if you are chewing Mentos. And you don't know most times, you just need to rest because you went through a lot of stress. Thank you for those who actually participated by listening. Now we are going into the interactive session. So I would like to call on the speaker that just left now. Dr. Joshua Falade is one of the panelists. Please, can you just applaud them, please? Dr. Joshua Falade, and the second person to co-anchor, or the second panelist now, excuse me, Miss Adedotun Eson. Please let us give her a round of applause as she steps forward. She is a mental health advocate and founder of the Mental Health with DT Foundation. So you should know we have a big catch here. Please let us applaud her once again. Thank you. And I hope you have your questions with you already. Thank you.
Good morning, Abuad students. Okay, you guys are going to answer me because it feels like you're very chill. So you're going to stand up. Can we stand up? Hello, can we stand up? Please, let's shake it off, shake it off, shake it off. So your hands up, both hands up. Oh my God, you guys are so chill. Wow, I like that. Please, shake it off, shake it off, shake it off. Your both hands up. Like this. And please put a smile on your face while you're doing that. Please, I can't see hands up. Especially those at the back. I love those sitting at the back. So I'm going to be coming to you a lot. So please raise your hands up, shake it off, and with a smile on your face. Okay, thank you. You can have your seat. Okay, good morning, everyone. And please, you guys need to know that this session is for you. Abuad is trying to serve you better. Abuad wants you to be better. Abuad wants you to have a perfect mental health. So please, you have to help us to help you. So good morning once more. My name is Ado-Ekiti, but I'm popularly called DT. So if you want to talk to me or say just call DT, that's fine. I'm a lot of things, amongst which is I'm a mental health advocate, I'm a public health practitioner, and many other things. So yesterday, we had sent out a short survey to the student body. At the top of my head, I can see over 100 people here, and I'm sure there are more than that. We only got 54 responses. So if you by any chance got a link for a survey, just give me a wave. 1, 2, 3. This side, did you get a link? So we got a lot of 200 level students. They're my champs for the survey. Did you get the link? Oh, wow. Please, can you say why? One person from this row. You didn't get any link. Is it because it wasn't sent to your platform or? What did you say? It wasn't sent. Okay. So our bad. We'll take responsibility for that. But the few responses that we got, they were very interesting. So that's where we're going to start these conversations from. And please, I am pleading with you. This is a safe space today. Don't worry, the Dean of Student Affairs is not going to hold anybody. I can assure you that. You're not going to be punished for anything. Please, take these few minutes and express yourself. If you don't want to ask the question, you can write it down anonymously and send it forward. So from the survey that we sent out yesterday, we had more female responding. So, hey, hi guys to the females. Hi, females. Okay, so we had more females responding. One of the key questions that we asked was, do you know that a mental health service exists in Abuad? 68% of the respondents said, yes, they know. And the remaining said they don't know. So that's where we're going to start the conversation from. The next question is, do you know where to get these services? 78% said no. So let's start there. Do we know where to get the service? Please, we need to answer so that we are communicating. If you know where to get the services from, truthfully, please raise your hand. What's going on? These people wearing green. I'm very interested. What's happening? You don't speak. Okay, do you know where to get the mental health services from? If you do, hands up. It's okay if you don't know. Do you know? You don't know. Okay, if you don't know where to get the service from, raise your hands. Okay, so I have some people that have not raised their hands at all. Why? Are we bothering you? Are you mad at us? Please, can you answer me? You know I'm not an Abuad person. So please don't let me go home sad. Please, can you respond? Do we know where to get the service from? Yes, raise your hand. I assume every other person don't know. So that's my first assumption yesterday. We assume that a lot of the students know where to get the service from, but most of them don't know. Or they are pretending not to know. That's also an assumption. So please, from the guest lecture, it says these services are available to you. The next question was that, would you access this service? So for those that know, would you access the service? 83% said no. And I was worried. Why? And from previous questions, a lot of people that responded also identified that they are stressed. Abuad is stressing them out. Abuad is impacting on their mental health. These were the answers that I saw. I'm specifically saying it. And I can relate to that, trust me. So please, I would like you to tell me, if you don't want to say it, please write it down again now. Why would you not access a service that is available to you? So following that question was, if you had said no, why? One very interesting response was that there is nothing in Abuad that is free or that doesn't come with a fee. That was a response. So, and I'm sure that these services are available to you, but you're not using it. And the last very interesting question was, how would you want this service to be given to you that will encourage you to access? And that's why I got the most beautiful question, the response, where people said it has to be very confidential, that you feel like people judge you, you're not being listened to. And a lot of people said they don't think they need it. So, do we think we need mental health services? I like that, yes. I like that, yes. Please, we all need it, and you can also see from the lecture. So now, the question that I'll be throwing at you that you guys need to start giving us feedback is, as a student of Abuad, given the fact that the education system is stressful, it is very stressful. I have been there. I also attended a private university. I know what it feels like. Then most of us would have been studying something that we're not particularly interested in. When I wanted to get into school, I told my dad I wanted to study theater art. And he said, never, it can never be in this house. And that time, no social media, no content creation, no skit makers, so it didn't make sense. And he said I should go to medical school. Boom. Okay, but I don't want to be a doctor. Just do something in the medical line. So we did something in the medical line. I went and studied 6 years, medical lab science, private university, all the stress, boom, boom, boom. I came out, I was sad. I felt unfulfilled, I felt very unhappy, and all of that. 6 years into the practice, I resigned from the job, government job. People said, you're crazy, how will you leave a government job? What is wrong with you? I gave my own coconut head explanation. 6 years after, no work, nothing. Then I went back to school to study my master's in public health. I came back public health from away and back to Nigeria, expecting that this guy is just going to go and get an NGO job and be collecting money. I came back and I said I want to do mental health. Are you crazy? What is mental health? And long story short, we are here today. So I understand the stress that you might be going through. So now we want you to look inward. Yes, the stresses are there. We understand that stresses are normal. What would you rather the school do to help you be better to manage your stress? Thank you. One hand. I want more hands. So I'm going to take hands from, I have people wearing red, white and black, green, yellow. Please raise your hands. What would you prefer the school does to help you manage your mental health? I have one hand already. Another person. Two. Please, what's going on here? They don't like talking in there. What department are they in? Engineering. Engineering students are very, what's going on? Okay, so one person, what would you prefer the school does to help you manage your mental health? Okay, I'm going to pick somebody. Yeah. You with the red glasses frame. Sister. Yes. You're going to tell us what you think the school should do. Don't worry, nobody is going to come for you after this. Okay, so the first person. And if you have any question at all you want to ask, please write it down if you don't want to ask standing. Write it down and send it forward. Carry on.
Okay, good morning. I have to say to Dr. Joshua Falade, thank you very much for your presentation earlier. The first thing I want to say is, sorry, this is not a first question. Please, is it possible for us to get the slide of your presentation sent to us after this? Then, for your question, ma'am, for me personally, I know about the mental health services that are available to our students. And personally, I've struggled with a couple of mental health issues, and I've had a couple of my friends struggle as well. And one of the limitations to receiving, at least to going to the clinic, the mental health clinic on Tuesdays and Fridays, the major one that I picked up upon was the price. I think currently it's for every clinic visit, it's about 2,000 or 2,500. And to me, if someone, at least for my friend that was going through a lot in that particular period, I think she had to visit at least twice a week during that time frame. And it was a big cost on her, and some other people that can't tell their parents that they are struggling with mental health issues because some of our parents don't agree that mental health issues are real. You can't exactly tell them, I need this kind of amount extra every month to cover that cost. So she had to bear the burden. So my suggestion, okay, in our school fees, we pay, I think 50,000 is allocated to visit the medical health, to visit the hospital. And so when we visit at every time, I think a certain amount of money for our treatment is cut off from that amount every time we visit. And the balance, well, the balance doesn't go anywhere. So my suggestion is that the mental health clinic visits price should be added into it. So we don't have to pay again when we are going to visit the mental health clinic. It should be added. And if we visit more times, the money finishes in the academic year, then we can start paying. It will make it more accessible for us to start going. It will make it more accessible for people to start visiting when they know that they don't have to pay out of pocket at first. Because many people, they come to school and probably the whole year, they never have malaria or anything that makes them visit the GOPD. But they have mental health issues, and they realize that, oh, their 50K that they paid for health services goes nowhere, but they still have to pay out of pocket to visit the mental health clinic.
Please, can you give her a round of applause?
Okay, so I'll just ask the rest of my questions now. These are, okay. In the doctor's presentation, he mentioned that some of the ways to keep up your mental health, you have to do a mental examination. And I wanted to ask him to explore that for, like, what are the exact things you ask yourself? Like, to do a mental, like if you're doing a physical examinations, you know, you check your blood pressure, you check certain things, you check your height, you check your weight. So in a mental examination, if you're examining yourself, what questions will you ask yourself to check that you're actually all right mentally? Because sometimes we think we're all right, but we're not all right. Then, on that thing, related to that, what kind of questions would you ask a friend to know if they're all right? Because some people don't, even if they have these symptoms, if you're not exactly living with them, you might not notice it. So how do we diagnose a friend quickly? Early diagnosis and treatments, that's what we're aiming at. And when we do diagnose these classmates, what steps can we take? Apart from just telling them to visit the mental health clinic, because some people who don't accept that they have to go to the mental health clinic. So what can we do? Who can we, I don't say report to, who can we tell to okay, to tell this person, like, oh, like if your friend faints in the room now, you can go and tell the porter and call the ambulance and carry them to the hospital. If you know your friend is having depression, who do you call to say, this person needs help? I noticed that my friend needs help. Please, let's do something. Who do you call? Then, those are like, what relevant questions do you ask and what steps do you take? Then, lastly, for the mental health hotline that was released, I'm trying to ask, can we use it like for emergency services, like people that have anxiety attacks that are somewhere and they can't move, they can't reach out to a friend at that moment? Can we just call anytime for emergency services, and probably, if necessary, they can talk to us over the phone and just help us get better, because sometimes we can't just come to the hospital because of certain things, we're ashamed or something. Can we use that as well? Can we use it for emergency services? Basically, that's my question. Thank you very much.
Amazing. Amazing. And thank you very much for the questions and the suggestions. So first thing, even globally, not just in the school, the cost of mental health services is a huge barrier to seeking service. So the suggestion that you have made, I am sure that the school authority has taken note of that. And it's a very good one, because when we are talking about universal health coverage, this is also universal health coverage. If you want people to seek care, you should make it affordable, accessible, and of a good quality. So the second question around what to look out for, I'm going to give a bit, and I will leave it back to Dr. Falade. So in my line of work, there's something called mental health first aid. I'm a mental health first aider. So that's one thing that helps you to identify. So when he was giving the signs and symptoms, there are a lot of things that you look out for. And because mental health is not a one-size-fits-all, not everybody is going to express signs and symptoms the same way. So let's take, for instance, one thing you know that you can look out for is mood. But when someone's mood switches abruptly right now, and in 2-3 days the person feels better, it might not really be a cause for alarm. But if you know your friend is very bubbly, your friend is all energetic, then you start noticing that energy level drops. Maybe the person usually eats a lot, the person starts eating less, or the other way, the person is a very peckish eater. All of a sudden, the person starts to binge eat. The person sleeps normally, or the person is not. So you look out for this thing, but it must happen consistently for at least 2 weeks. That's what I've come to realize. So I'm sure the hotline will be better, but it has to be counselors. Another thing that we have found to work within the school space is peer support. So one of the schools that I worked with, what we did was we created support groups, and we had champions that were trained on mental health first aid. Because I also realized that students would rather talk to themselves than talk to a school authority. So these champions can also be a way to help you express. Because not every time you actually need medication. You just need somebody to understand you. You need somebody to just listen to you and make you feel like you're not alone. So I'm sure those hotlines will be improved, but that's my take on your question. I'll leave Dr. Falade to give an input before we go to the next question.
Well, thank you. On the cost, I think at a point, I think with AMSA, we're working with the hospital management. Dr. Kemade is here to see how we can subsidize the cost of coming to the clinic. That has gotten to a point, and I'm sure probably he will speak on that. And if I think the hospital management will further activate that. That's a genuine complaint. What we were looking at is not to make the clinic visit pay as you come. We will chunk it together for this section of clinic visit, this section of psychotherapy. This is how much you will pay. Don't worry, my boss is here. He will speak to that and work on that. Yeah, the slide, you can get this slide. Mental state examination. Let me drop this. Mental illnesses, they are painless illness. If you break your leg, you have headache and so on and so forth, you feel the pains. But most psychological illness is painless. So the people that are going through, they'll feel as if there is nothing, especially if they don't have insight. You have many people to talk to. If you find out that something is going wrong with your friend, the hotline, you can call that line. I'm sure if you call that line, but please don't abuse the line. Please don't abuse the line. Somebody will pick that call, but please don't abuse the line. Apart from this, the hospital has lines that you can call in the face of crisis or emergency that you get somebody to pick. Besides, I think each hostel have people you can talk to in the case of crisis that can quickly help you pick the person. If you find out that a friend has changed, like he has rightly said here, you find out the behavior has changed, please, you can come to the department. Tell the doctor there. We have nurses, we have counselors there. Please tell them. Then we have mentors, dean of student affairs, and so on and so forth. Please, just tell them. You are not reporting the person. You are doing good for the person. Or know that. For mental state examination, you have to come who assess you. There are ways to do that. Thank you.
Thank you very much, sir. A round of applause for that. Okay, so we have about 10 minutes for this session, and I'm sure we cannot exhaust your questions. But like we said earlier, can you just write these questions and pass it on? Somehow we're going to get answers for it. You have questions, please.
Okay, so the first, it's not a question. I think the person just expressed what is on our mind. I don't know if I got it from a her or he. She said, I'm forced here against my will, and that is affecting my mental health badly.
So to be in this event?
What did you say?
Is it if you are forced to be in the event or in the school?
Here, like in the
this
event. Yes.
Awesome.
All right, that's okay, that's okay. That's okay. Well, it's for the best, if you ask me. All right, so one of the reasons why people don't go is because they feel they will be judged, and the counselors speak about it to other people. And someone also mentioned that at the medical side, that they don't have a counselor there. Yes, that they only have counselors around this axis.
So this is a particular problem, because even in the survey, this was it had the highest response. So.
Okay. Now, my question is, can medical students get proper breaks between every posting? Not just 1 week or 3 days. Staying in this place for too long is so disheartening.
Hold on. I'm going to address that. I'm going to address that in 2 minutes. Let's be realistic. I was in the medical school. Medical school is hard. And you know how the curriculum is hard. But the truth is that because we have not found a way to manage this timing, it's stressful to be in medical school. If they ask you to go home and come back, you relocate your stress home and bring it back. But what you need to learn is, how do you cope with this stress? It's difficult, trust me. I was there. There were times I tried to run away from school. But you have to look at it, how do I manage it with the stress? So I see all of you clapping, but I thought to put that there. I'm not your friend right now, but yes, that's the reality. Next one.
All right. Does one need to have a specific reason for seeing a therapist, or just use it as an opportunity to get things off their mind? Better said, what is the goal for therapy? That's 1. 2, I have a friend that lost her brother 2 years ago. Apparently, he had depression due to childhood trauma. His mother is a psychiatric nurse. She said, I work in the hospital setting, and as a nurse, I know how people with mental illness get judged. I can't let my son attend the clinic. What would they say about me? Now the question is, what is being done with confidentiality? Is it only applicable to doctors? What of nurses and other healthcare workers? Now, we are in social media age. Almost every day when you open TikTok, the suicide rate is very high. They talked about rehab. However, they still lost the war and fight. Why? At this point, it is looking as if it is not helping. Now, the last question I have with me, I think this is directed to Dr. Joseph. In the lecture, you mentioned parenting being a risk factor. How can you take care of a family with more than 3 kids and prevent victim complex? If there is victim complex, what can be done? So that's for all the questions, but I think someone wants to ask a question there.
Okay, should we address this because of time?
I feel we should put it together. Yes.
Good morning, Ma. Good morning, sir. Thank you for your presentation. My question is, or the answer to a question you asked, you said that why don't people visit the mental health clinic? I would say that the first thing that will come to mind is the stigma. They don't think that, most people think that you're actually running mad or you're going there because of substance abuse. Now, I think that, like one of the questions that was asked, that there should be a proper mental health professional in the colleges that somebody can just walk to. You leave class, you go to college and just speak to that person, and if you need to be referred confidentially, you can then be sent to the hospital. Also, I also want to state that, can there be training sessions for lecturers on student mental health? A lot of times when students, quote unquote, misbehave, they just tag you as unserious and irresponsible, while people are genuinely going through mental health issues. And I understand that most of our lecturers, their ideologies are different because they're from a different generation. So it's easy for them to say, I passed through this during my time, I crossed 7 oceans and rivers, so you cannot be sad. So please, can they actually be trained on certain areas? And if it's possible, confidentially, if a student is known to have a mental health issue in the hospital, is there a way that some of these lecturers can know so they don't treat the student, maybe the student is misbehaving or something, they understand that, okay, this student is going through this thing and they are treated properly in class. Thank you very much.
Well, thank you. Let me just summarize the questions. Thank you for asking us these questions. You can bring in your questions, we will answer it and look for a way to get back to you. So you can still write your questions. We may not answer it here, but I want to tell you we'll answer those questions and get back to you. Number one is, if you are a victim of bad parenting, I said it's a risk factor for psychological illness. Please throw away the shame, throw away the stigma. Please come to the department. Let us see you. I'm a consultant psychiatrist, an addiction expert. And by the grace of God, I am working with team that are experts. We have, as somebody talk about nurses. Let me tell you this, that you have one that is probably plus or minus, you don't like the attitude. That you cannot generalize that. That's what we call overgeneralization. I know that if you have had an experience with an unprofessional professional, there is risk of generalizing that all doctors are bad, all nurses are this. But that does not rule away the fact that you have those that are cerebral, that are cortical, and that are professional. Come to the mental health department. You will find professional people, professional workers there. Please come, let us see you. For the training taking, we'll work towards that. I think those are the things I jotted down.
Okay, so we're going to be rounding up, but I would just like to leave some nuggets for you to take with you. Life is hard, generally, and being a student is harder. And the transition between the old people and the new people, like this current generation. There's a lot of transition that has happened. Mental health issue is not a one-off thing. There's a huge stigma. And the stigma is because there's a huge knowledge gap. And who is going to bring this knowledge? It's you and I. We all have a part to play. But the most important thing is, how do you help yourself? You have to help yourself. You have to be sound before you can help the next person. And thanks to social media, there's a lot of pressure. But what I want to tell you is that, yes, not everything that we see on the socials are very true. Our realities are different. Our lifestyles are different. And people are going to show you what they want you to see. But in the midst of whatever you're going through right now, can you identify things that are working right for you? Because many times what I've come to realize is that mental health issues happen because we look at the things that are not working right. We look at the things that we want so bad that we don't have, and we neglect the things that we have. Trust me, many of you seated here, I would say you're opportune to be in school. Can we start looking at life from that aspect of what is working right? Many of you are here out of your own will. I don't have time, I would have shared my story. There is nothing that is impossible. But one thing you need to learn is every step is pushing you to the right direction, if you can see it as that. And your journey is most important. So where you want to be, who you want to be. My father that told me about 20-something years plus ago not to be an actor. He saw me on TV for the first time 2 years ago. And he was saying, that's my daughter. And I'm like, oh yeah. It's easy to say that's your daughter, but you didn't want me to be on TV. If you had allowed me, maybe I'll be a superstar now. But the truth is that every step is going to move you towards your direction where you need to be. And nothing is a waste. I went to school, I studied medical laboratory science for 6 years. I stayed there. I am not practicing right now. I don't even know how to hold a pipette right now. But that lesson makes me empathetic to medical students right now. It gives me idea of what to do if there's a problem. So not everything goes to waste. Please. It's difficult in Abuad right now, but it's also difficult out there. We want to get out of school now, want to be independent. Then you go out there, then life is going to show you shege. Like shege. Then you feel like, oh, why did I want this freedom so bad? So every stage of our lives, the previous prepares you for the next. So please, feel free to let it out. One of the things I tell people is please let it out. But yes, we don't know who to trust because of confidentiality, because of privacy issue. But if you identify one person that you can vent to, please take advantage of that and create a good community for yourself. Because this communal living also is an advantage and not necessarily a disadvantage. So that's my last word for you. Please prioritize your mental health. Prioritize the mental health of your friend, your neighbor, and everybody. And every day, look forward to being a better version of yourself. Thank you.
We can do better. Wow. I actually enjoyed the interactive session. I wished we were not constrained by time. This is a topic that needs to be delved more into for a deeper knowledge of how to understand our mental health. Like I said earlier, we have someone or we know someone who is battling one thing or the other. So I wished we had more time to discuss these. All right, we are gradually coming to the end of today's program. Now, to give the vote of thanks, I want to call on Mrs. Kamodi Kehinde, the matron in charge of Mental Health Department, AMSH.
We are still in the morning time. Good morning to you all. So, on behalf of myself and Mental Health Department, I'm saying a big thank you to Baba Are and his wife for making these occasions possible by sponsoring us. According to one musician that say, without money, nothing can be done. So, my sincere thanks to him. I'm also saying a big thank you to all board of trustees of Abuad Multisystem Hospital and the school. My able consultant, Dr. Faraday, thank you. Dr. Akinwande, thanks for everything you've been doing to assist the community. They said it all. Information is the foundation of transformation. You've had it all now. Please and please. You said something. Let me quickly react to this your comment because of our time. You said there is nothing in Abuad that is free or was free. Yes, but I want you people to know that as far as mental health department is concerned, we are trying our possible best to help or assist our students. So I'm also advising you about the coping strategy. Please, if you are confronting or you are facing any psychosocial issue, you don't need to wait until they bundle you down to the department before coming down here. I assure you, if it is just to come for advice or counseling, we are not going to charge you and we will not be charging anybody on this. Just come to meet us and I assure you of the confidentiality. Even sometimes, I remember vividly well, I'm not supposed to say this because of my boss is there. We are trying to assist you in terms of reducing the cost. A student was preparing for her final exam when she lost her dad. We admitted that even she spent those few days because of the money, we finalized her bed just to reduce the burden charge. Please and please, once again, I assure you of the confidentiality. If you are facing with any psychosocial issue, don't stay and don't wait until they bundle you like like animal. Please and please, may the Almighty God continue to protect you. You fall matriculated by the special grace of God. You are going to convocate with good grace. Thank you.
Thank you, ma'am. All right, a quick one. Those of you that have questions to ask, something you don't want to throw out in the public. Mrs. Ado-Ekiti said I should tell you she has an extra 1 hour, so you can just meet her later at that side of the hall, to ask your questions and gain more enlightenment on whatever it is that is bothering your mind. Did you enjoy today's program? Why is it that the energy is to my right hand? Those of you on my left hand, did you enjoy today's program? Engineering students, did you enjoy today's program? It is well. All right, we've come to the end of today's program. Let us rise to our feet as we take the Abuad the Abuad anthem. Rise to your feet, Abuad anthem.
Street and pursue excellence with determination. And faith in our philosophy of industry, service and character. Our futures for greatness and excellence is assured. And excellence is assured. And excellence is assured.
All right, thank you. The photo session, please. I've been told to tell you to move to this side of the hall to have, okay, here, at the middle here, to have a photo session. Students, please, you have to come out for the photo session also. Please come out for the photo session.